Thank you, ma'am. And I first of all want to thank RSSDI and my chairs, Dr. Chandni Jaggi ma'am and Dr. Bharat Saboo sir, for giving me this opportunity again for the second time, because last year also I was there and I was lucky enough to present the Central India data for the MMS Ahuja Symposium. And this actually again I would like to thank, because this topic actually has revealed something to me also, which I would reveal to you. So the topic which was assigned to me was correlation of systolic and diastolic dysfunction in both symptomatic as well as asymptomatic patients with microvascular complication in type 2 diabetes, and my data was focused to Central India. I have nothing to disclose as far as this study is concerned. Now, to introduce diabetes, we all know it is the most prevalent non-communicable disorder, and incidence is growing gradually globally. And in 2019, 463 million adults were living with diabetes, and this is going to increase by a huge number, we know. And we all know that most of the people with type 2 diabetes live in developing countries, because this becomes significant because we don't have access to that much diagnostic care which should be required for the cardiac evaluation. And 1 in 5 patients who are above 65, they have diabetes. That is again the age group which is very susceptible to cardiac disorders. Now, the diabetic patient, they themselves have a 2 to 5-fold increased risk of cardiac diseases, and both systolic and diastolic heart failure we see in our clinics is very common with diabetic patients. Now, microvascular complication, these are very, very easy to detect in our clinic. We can very easily detect these micro and macrovascular complications, and most of us are doing it very regularly. So these microvascular complications can give us a way and can lead us towards, I would say, pointing out those patients who can have a future risk or having a risk of systolic and diastolic dysfunction. So this was the introduction, and with this introduction we had the objective, which was to see the correlation of systolic and diastolic blood dysfunction and correlate it with microvascular complication, neuropathy, retinopathy and nephropathy in type 2 diabetes patient. For this, we did a retrospective observational study, and patient data from August 2021 to October 2021 from 5 centers around Central India was analyzed. Out of those, 162 patients with type 2 diabetes with cardiac dysfunction were picked up, and 160 patients with no cardiac dysfunction on 2D echo were randomly selected. So all the participants were those were included were evaluated for nephropathy, neuropathy and retinopathy by the standard means to detect it. And then they underwent conventional 2-dimensional echo done by the commercially available echocardiography machines. Data was recorded on MS Excel sheet and analyzed by using SPSS software. So this was the patient selection flow. We screened the data for around 11,000 odd patients, and 8,000 odd patients with type 2 DM were identified out of it. And we excluded 8,000 patients because we had a huge list of exclusion criteria. We selected 322 patients, 162 patients with cardiac dysfunction with diabetes, and 160 patients with diabetes and no cardiac dysfunction. So the inclusion criteria were very simple: patients more than 18 years of age, those who were able to give informed consent, a verified diagnosis of diabetes mellitus, duration of diabetes more than 2 years, just to exclude those patients who may have a hyperglycemia due to COVID or post-COVID effects. And they should be a resident of Central India, because our study was focused only to the Central India. The exclusion criteria were uncontrolled hypertension, abnormal ECG, atrial fibrillation, moderate to severe aortic or mitral valvular disease, a poor echocardiographic window, COPD or bronchial asthma in the patient, renal failure, thyroid dysfunction, and severe anemia. Now, these were the baseline parameters of the study population which we selected. Those were with cardiac dysfunction and without cardiac dysfunction. Now, the result and analysis. This was really startling. In terms of microvascular complication, when we saw about the neuropathy, out of the total patients who had neuropathy, 64% patient have some sort of cardiac dysfunction. While patient, when they did not had neuropathy, the incidence of or the prevalence of cardiac dysfunction was only 18%. This was again seen in asymptomatic patients also. So patients, those who were asymptomatic, if they had neuropathy, they had 36% patient, they had some sort of cardiac dysfunction. While the association between this cardiac dysfunction and neuropathy goes down when there is no neuropathy. Only 12% patient had cardiac dysfunction, which was asymptomatic. With retinopathy, we have seen that 44% of patients were having cardiac dysfunction when they had associated retinopathy with them. While if they don't had retinopathy, only 20% patient had a cardiac dysfunction. Now the asymptomatic patients, when we saw the retinopathy, when it was there in asymptomatic patient, the associated cardiac dysfunction was 31%. And when there was no retinopathy, we only found 13% patient to have a cardiac dysfunction. The results for nephropathy were almost similar. We saw a patient who is having nephropathy to have cardiac dysfunction in 42% of cases. When there was no nephropathy, around 21% patient had cardiac dysfunction. But when the patient was asymptomatic, the patient, if he is having nephropathy, the risk of cardiac dysfunction was 36%, while when he didn't had any nephropathy, it was only 13%. So this result clearly show a positive correlation between microvascular complication and the cardiac dysfunction. Those who had a microvascular complication, they are definitely at a higher risk of cardiac dysfunction, and reverse is also seen. If they are not having a microvascular complication, then their chances of having a cardiac dysfunction are less, so that we can rule out those patients to have a cardiac dysfunction. Now, why this study is important? Because there is a strong association between microvascular complication and systolic and diastolic dysfunction, which has been proven by our study. It is a unique sort of study because we studied a lot of data, but it proved to be a little unique because it included all the three parameters in a single study of microvascular complication. And probably it is one of the first kind of study in central India, to place where I belong. So hence a risk stratification model should be devised for early CVD evaluation based on these readily detectable microvascular complication screening parameters, because these are very readily available with us in our clinics, and any diabetologist or general physician can very easily do and prevent the cardiovascular health of patient. The significance is further strengthened by the belief of mutual existence of cardiac and microvascular complication. And microvascular complication can be considered as a sine qua non for cardiovascular complication. As we see, a simple test, neuropathy, when it is there, that 64% of those with diabetic neuropathy, they also have a subclinical cardiac dysfunction. Being asymptomatic, they would have been missed, and it is a great loss to society. Now, limitation, like any other study, this study had certain limitation. We had a very small sample size. A larger study, that is why is recommended in order to increase the statistical power of the study. Data was not obtained for the gender-specific comorbidities. This was a limitation which I found in my study, and which can be related to cardiovascular disorder according to the gender. And I was geographically restricted to central India only, so this is again a big limitation because this doesn't represent the big picture as of India. Now the key messages are, because India together with Southeast Asia, we know we carry the highest burden of diabetes, mellitus and heart disease, being the most common cause of mortality amongst us. So it is always important to detect this disorder early, and being able to identify those at high risk patient with a simple technique of microvascular complication evaluation, and in the presence of these microvascular complication, they can pave the way for the future prevention of cardiovascular health. And this is the key learning point of this study. These are my references, and with this, I thank you all for the patient listening.